Hey everybody, welcome back to my channel. And this is Kat with Second Act Kat RN. I wanted to give you another topic in this series of the elephant in the room. And oftentimes elderly or older people will have thoughts about things that they're concerned about, and they don't mention those things to other people. They keep those things buried deep inside, and sometimes it's because they don't want to accept that they are at the point where they have to start dealing with those things. Sometimes it's just denial, denying that they're of a certain age and that things are inevitable at that age. So one of the elephants in the room for older people, it concerns death and end of life planning. So I know that holds true for me. And I was a hospice nurse three different times for two different companies. And we had to, sometimes when we would admit a patient, most of the times they would already have their end of life forms filled out. But if I admitted a patient to hospice and they did not have their post form filled out, then it was my responsibility to explain to them all the different options for care or not when the time comes. For example, if somebody did not want to be on any kind of life support, then they would sign a certain portion of the form, the post form. They had options also on that form of determining how much end of life care or life sustaining measures to take. So you had options. You could do IV fluids for comfort or antibiotics for an infection, and that's a comfort thing as well when the person is actively dying. So I feel like because I was able to educate those patients on the post form and end of life options, that it gave me a better understanding. However, I'm just human, and I'm just like these people that don't want to talk about it. You know, for the longest time, I never did any advanced care planning for myself, even though I understood the urgency of it for hospice patients. So I finally did, after my mom passed away about almost 5 years ago. I decided to go ahead and do my paperwork and have an attorney go through and sign and give me the proper paperwork and sign. So I did get that taken care of, but it took me years of explaining it to patients before I would implement it for my own self. So a couple of the things I wanted to talk about are feelings about death by older people, and then feelings about end of life planning. Excuse me. So one of the feelings about death is acceptance. So a lot of people view acceptance as it's a normal part of life, and dying is a normal part of life, and you accept that you're going to die. But another thing they think about is the fear of the dying process. Maybe that bothers me in a different way because I saw the dying process with hospice patients. I was there when they actually passed. I was there prior to passing. I was there after they passed. So just seeing that day-to-day process opened my eyes to what to expect. I know a lot of people don't get that experience to view somebody that's actively dying and then passes away, so they don't have that understanding of the process. So one of the things I would explain to hospice patients is death is just a natural process. Everything you see the patient going through, they are suffering to a degree. You have medications for that, but everything you see them going through is a part of the dying process. I had a lot of family members that were very concerned with a lot of symptoms that patients had towards the end of their life. And they were very concerned that something's weird or they're not That's not normal. I had to explain to them that that is a part of the dying process. And we try to help family members, especially, not have that fear of the dying process for their loved one. However, as the loved one or the one that is going through that process, you need to have explanations as well from the nurse or a provider that these processes are normal and what to expect in the chance that you are going to be actively dying. It may be 6 months, it may be a year, it may be overnight. So explaining that process to a patient on hospice is helping them to kind of know what might be coming down the pike and what to expect. So that does alleviate a little bit of maybe the questions around how am I going to be when I'm dying. But I don't think it takes care of the fear of the dying process because it is an unknown to people. So naturally, there is that fear to anticipate that unknown. Even though you explain to them, they may not still have, I guess, accepted maybe or understood completely until they actually go through the process. So another feeling about death that older people have is the desire for peace. So maybe someone has a terminal illness and they're in a lot of pain and discomfort and they've been that way for a long time. That stress takes its toll on a body and on the mind. So a lot of elderly people that I know that have been in that situation, nearing death or having some kind of a comorbidity, they oftentimes wish for that peace, to be free from that pain and the struggle that they're going through. So another feeling about death that older people have is becoming a burden when you're having to be taken care of by family members when you are going through that dying process. So that's one of the things that definitely should be talked about in the family. Maybe before you get to that point, if you're able to, that person needs to know that if they're taken care of by family members in their last days, that's a welcome blessing, and that's something they shouldn't fear. They should not fear that it is a burden. They shouldn't fear that it's putting their family members out or it's too much for them. Their job really is to, I guess, transition from this life into the next with peace and dignity. So I know that it's hard to talk someone out of worrying about something like this, but maybe if you have those talks with your loved one, or if you're the patient and you feel you have that fear, go ahead and try to talk about it with someone, friends, family, medical providers, just so you can get an understanding and hopefully squash that fear of being a burden to your family or to someone. One more worry about death is that you are making an impact on others. So they worry about, say you have a spouse and you're leaving them behind, they're going to be left with everything to take care of after you pass away. So thinking about how that's going to be a burden, let's say if I was married and I'm passing away and I'm actively dying, I'm sure that I would worry about, is my spouse going to be okay? Are they going to make it? Are they going to be able to survive? Are they going to be able to handle the day-to-day activities, the bills, just everything that's involved with regard to living? Are they going to be able to handle that? And are they going to be able to remarry in the future? Maybe not, maybe so. But these are thoughts that an elderly person or an older person thinks of when they get closer to death. Even for me, I'm not close to death yet, I hope. And obviously we can't predict. But I feel like I'm starting to think about those things. One of the thoughts I've had probably for the last 10 years or so, is I wonder what old people think about dying. I actually have had that in the back of my mind for about that long, about 10 years or so, give or take. And it almost was like I want to ask an older person, how do you feel about death and dying? How do you feel about the dying process? Do you have concerns? And I'm starting to see that I'm having some of those concerns, not all of them. I imagine if I was sick with a terminal illness, I would probably have all of those concerns. But at this point, there are just a few that I'm starting to wonder about. So these are things that are normal when you are an older person, especially when you get up into your elderly years. These are thoughts that you're going to have, and that's okay. These thoughts are okay to have. It's okay to discuss these with family. Just because you discuss these thoughts or your questions about death does not mean that that's going to bring you closer to death. Obviously, every day we live, we are getting closer, but it's not like you're going to jinx yourself by talking about these issues. And the reason I say jinx yourself is I've had hospice patients whose family members did not want them to have any kind of pain control, specifically a liquid pain control that you give people in their last days that helps them to breathe, helps their pain, helps them to relax. And the reason they didn't want their loved one to have these medications, or this particular one, is because they thought that would create or make the death come sooner. You would make that patient die by giving them that medication. So we did not hasten the death of patients by giving them this particular medication, because we were making sure they were comfortable to where when the time came and they could transition, or they did transition, they could do so peacefully and at rest. So I don't like to think about something as being, a catalyst for death, like you give the medication and then that expedites death, or when you're talking about it, that expedites death. So these thoughts about these two issues aren't exactly true. They're not exactly valid. So they do need to be discussed so that we can better help families and the patients to understand this is just a peaceful way to help them transition. It's a way to help them transition peacefully. Another topic is how to approach conversations with an older person about death and the dying process. So generally, you let them lead with questions they may have, but I'd like to add to that, bringing it up in a very caring, loving way, not pressuring that person, but letting them know the door's open to be able to talk about these issues. If they have something that they're very concerned about, or an issue regarding the dying process that they feel the need to discuss, that opens the door for communication and understanding about the dying process. So I do encourage that. Another thing about when you're approaching that conversation with a loved one who's older is being a support system and being a good listener. A lot of times we want to interject our thoughts in somebody's concerns, and I think that kind of does an injustice maybe, because it shows them that you're concerned about your thoughts rather than entertaining and hoping to explain and understand what they're thinking. So even though you may have thoughts about your own death and the dying process, it's best to be a good listener and to understand what they're trying to tell you, so that you can support them with answers to these questions. Even if you don't have answers, just understanding and caring and listening. So be a good listener for someone that is expressing their concerns about the dying process. The next thing under that would be to focus on preferences. So if the planning of end of life issues is a problem, just understand what their preferences are for medical care so that you respect and honor what they would like. I worked in the ER, and we would have patients who had passed away and family members, or maybe they were close to passing away. We had someone brought in who had been found on her kitchen floor, so we had to implement life-saving measures to see if we could save her life. And the family was concerned about that because they did not want there to be any kind of interventions, even though the patient had indicated that on their post form. So respect what their wishes are. That's a hard thing to do sometimes. I know my mom's post form, she wanted no intubation. She wanted no ICU care, no IVs, nothing like that. She wanted to go naturally, and she wanted to be cremated. So I have family, I have several sisters, and a few of them had a really difficult time with that. So we just need to respect the wishes of our loved one with regard to what they would like or request to be done for them when the time comes during the dying process. So that's very, very important. And I just want to encourage everybody that when you have a loved one, when you have a family member going through these things, you need to make sure that you are there. You lend a comforting presence and lending an ear to listen. Listening is probably the most important thing. I know they don't want to be challenged with regard to what their wishes are, and families can get into a lot of, I guess, the mud and the dirt about this topic because it's a hard thing to talk about. I don't want my loved one to suffer. I'll give you an example. When I worked in a hospital, we had a patient that was, if she became incapacitated, she did not want to be fed with tube feeding or any kind of artificial feeding. So if she could not eat by mouth, she didn't want any kind of nutrition to sustain her. Those were her wishes. And the family members that were in the room at the time were very upset because she couldn't eat, and they couldn't understand why we weren't feeding her. We had to explain about her wishes, and they didn't like that. They were hurting. They were in such pain because their loved one, they felt, was suffering. But this is what the loved one chose. They did not want any interventions to try to keep, she didn't want any interventions to try to keep herself alive. If she was going to die, she wanted to go through that process naturally. And the family had a hard time with that. But that's something you have to come to grips with. It's very difficult. It's extremely difficult. My mom was put on, she was intubated because the facility thought she was a full code and she was a DNR. They had lost her form and filled another one out and had on record she was a full code. They intubated her, and we decided to leave her intubated until all of us could come together and be there, even though she didn't want that. But they had already intubated her, so we thought, let's just go ahead and leave it. We wouldn't have chosen that. She didn't want that. But so we can all get up there and say goodbye to her, we decided to leave her on intubation. And at one point I spoke to her provider because I felt bad that she wasn't able to eat. And I had to struggle with that. I had to struggle with it. And the provider had, talked to me about the fact that she was a DNR and there was no nutrition that was going to help her come out of this alive. It was already predetermined that she was going to pass away because of all of her issues. So I know what a struggle it is to not want to follow their wishes, or to want to follow their wishes, but having a hard time dealing with it. I think that's pretty much what it was. I had a hard time, but I did honor her wishes. So, we did not implement any kind of artificial nutrition. So anyway, I just really encourage you to have these conversations in a gentle way, providing dignity and respect to the loved one that may be facing death, or maybe thinking about it even though they're not there yet. So be alert to these thoughts that these people are having at this older age, because we are nearing death. Every day we near death. We're getting older every second. So these are things we need to deal with, and we need to talk about, and we need to address. So I hope everybody has a wonderful weekend, and take care until next time.